As weekend warriors and baby boomers age, knee replacements are on the rise. According to a recent study in the Journal of American Medical Association, 3.5 million adults are expected to undergo knee replacement surgery by 2030. Advances in technology are helping many patients to regain complete mobility while spending less time rehabilitating from surgery.
The human knee is a remarkably durable joint, but wear and tear can take its toll. Repeated stress on the knee from exercise, obesity, or previous injuries often leads to osteoarthritis, a degenerative joint disease characterized by the breakdown and eventual loss of cartilage that serves as a cushion between bones. Dr. Corey Ponder is an orthopedic surgeon specializing in hip and knee replacement at St. Anthony Bone and Joint Hospital in Oklahoma City.
What happens is once the cartilage gets completely destroyed in the knee, to where you no longer have the cushion left, you get bone-on-bone contact between the thigh bone and the shin bone, and that develops severe inflammation and causes pain.
Conditions such as tendinitis or a tear in the cartilage can also lead to knee pain, but Ponder says the pain reaches a higher level for people with osteoarthritis.
People that end up needing knee replacements typically have pain severe enough that they're having pain that wakes them up at night, pain that starts causing other aches and pains in other parts of their body because they're limping, or pain that is keeping them from doing the things that they want to do, or even making them decide, hey, I don't want to go do my shopping today because my knee hurts too bad.
Before resorting to knee surgery, doctors try other treatments to repair the knee, including anti-inflammatory medicines and physical therapy. If those fail to relieve the pain, the last option is replacing the knee.
And a lot of older folks have that misconception that when we do a knee replacement, we're literally going in and taking out all the bone at the end of the thigh bone, top of the shin bone, and replacing that with metal and plastic. But really it's a misnomer. It should be called a knee resurfacing.
Ponder says the goal of resurfacing is to remove the diseased parts of the knee.
What you're seeing here on these red spots is arthritis. So during surgery, we basically, using instrumentation, either computer navigated or standard instrumentation, we remove those parts of arthritis, both from the end of the thigh bone and from the top of the shin bone.
A total knee replacement involves placing a prosthesis or artificial body part on the end of the joint. With a relatively new technique known as Makoplasty, the surgeon resurfaces part of the bone and inserts metal implants rather than replacing the entire knee.
We only resurface either just the inside part of the knee with a piece of metal on the thigh bone and on the shin bone with a piece of plastic between, or we can also resurface just the patellofemoral joint with a piece of metal and plastic, or on the outside.
With Makoplasty, the surgeon makes a three-dimensional map of the affected area and uses a robotic arm to perform the surgery.
And that allows us to then burr away just the bone that's involved, that is arthritic, down to the millimeter. And we're able to resurface just the diseased part of the knee.
The benefit of Makoplasty is a much shorter recovery time.
The recovery time is about 1/3 of the amount of time that we see with the total knee, which makes sense because we're doing about 1/3 of the work in the knee itself.
A patient undergoing full knee replacement will be about 80% recovered after 6 weeks, and it's likely to be a year before the knee feels normal again.
With the partial knee replacement, it's about 6 months' time that you're at that same point. And most people at 2 weeks are able to do everything that they want to do. So it's a substantial decrease in recovery time between those two procedures.
About 90% of patients still have their same surgically repaired knee 10 years later. Ponder says by avoiding things like running and jumping that cause stress to the knee, patients can get as much as 25 years out of their replacement knee.